And good morning, everyone. Welcome into a brand new edition of Sports Medicine Weekly on this Saturday morning. So happy you are with us. I'm Steve Kashul, joined by my usual co-host, Dr. Brian Cole. He is the head team physician for the Chicago Bulls, one of the team physicians for the Chicago White Sox, also sports medicine specialist, orthopedic surgeon at Midwest Orthopaedics at Rush. Our website is sportsmedicineweekly.com. And Dr. Cole, how are you on this Saturday morning?
Steve, I'm doing great. It's clearly feels better as the weather's starting to turn. You start to feel a little more normal, if you will. So doing very well. Hopefully your family are doing great.
Everybody's great on my side, Doc. I appreciate it. And let's get right into our first topic. As you said, the weather is turning. And great weekend this weekend, despite maybe some rain, but we understand that some travel baseball teams, maybe even soccer teams, other sports are starting to get into things. And we're going to bring on our first guest, one of your partners at Midwest Orthopaedics at Rush, Dr. Nick Verma. He is the head team physician for the Chicago White Sox and, like you, sports medicine specialist at Midwest Orthopaedics at Rush. So, Dr. Verma, thanks for joining us. Still waiting for the restart of Major League Baseball and Little League Baseball and college baseball all the way around. But Dr. Verma, as we bring you on this morning, tell us about some things as these travel teams and something hitting home for all of us, and me in particular with my boys, ready to get into the travel circuit again with hockey and baseball, and what should we be concerned about?
Well, thanks for having me, guys. It obviously is nice to see that we're starting to at least engage some discussions about how do we get back to some of the normal activities that we all enjoy. And sports is a big part of that for many of us, whether it's just watching sports or participating in sports or youth sports associated with our children. So I'm enjoying the fact that we're at least thinking about how to do this safely and how to do this appropriately. You know, we've been overwhelmed, I think, with the discussion about how this virus has affected us and how we return to sports safely from a keeping kids and adults healthy and avoiding getting sick from COVID. But one of the things that we probably need to spend a little more time on is how do we get people ramped back up to a level where they're able to participate, for example, in a travel baseball team where they may go down for a weekend and play in 3 or 4 games over a 3-day period. I think that this is a really unusual time in that even though organized sports was down, pretty much any access to training facilities or other training opportunities was down as well. So this is very unlike an off season, so to speak, where, you know, kids or young adults may still be going to the gym. They're still working out in training facilities. They're still conditioning for the return of the sports season or the start of the sports season. In many cases here, especially as we get to the youth level, there just weren't those opportunities. You know, you did what you could in your basement. If it was a nice day outside, you went to the park or outside for a run. So I think that we are going to have some risk here of increased injuries as we get back. And I think we've seen that already as some of the soccer leagues in Europe are starting off, and they've had a rash of injuries, so to speak, at the beginning. So I think it's something that we're going to have to be mindful of going forward.
Nick, what do you think we're going to see? In other words, the nature of startup in sports, sometimes it's a little predictable, and we've seen it in basketball, for example, after lockout periods or renegotiations. We saw it in the NFL, and not even necessarily pertaining to professional sports, but just specifically in baseball. What do you think our guys or our athletes are going to be most prone to developing, starting up from basically nothing as a ramp up, no runway to get there?
It's a great question, Brian. And as you know, there's certainly been a lot of work that's been done over the last 5 to 7 years with regard to many of the injuries we've seen. And much of it has to do with workload management, which is trying to control the amount of load that we put across tissues, organizing that so that load is increased sequentially. And we try to really avoid spikes in load. So if we're going from a very low load setting to a very high load setting over a short period of time. And I think that's really where the risk comes in as we start to ramp these sports up. Obviously, here in Chicago and other parts of the country, we're a little bit under the gun in that we have only a short duration of time before the seasons start to change again, and the outdoor sports are no longer available. So I think there is going to be a push to try to accelerate, let's call it a training camp type situation, and get directly into gameplay. So typically what we see in those situations, the things that I worry about are kind of the muscle strain type injuries. So for baseball, this would be the hamstring strains for our position players. But some of the weird strains that we see with our throwing athletes, with our pitchers, which would be things like oblique strains or lat strains, things where they're just really not in the condition to throw or throw with high velocity for long periods of time. And then, of course, the other thing we worry about significantly is the shoulders and the elbows in these throwing athletes, and how do we bring them back so that we're not overloading the joint in a short period of time and creating a big problem. So I think we'll see a little bit of a dichotomy. We'll see some more of these sprain strain type issues, which are not long-term sequelae problems, but do take athletes out from sports for anywhere from 2 to 12 weeks. But I am a little bit concerned that we may see bigger problems with elbow injuries or shoulder injuries that can be really difficult to manage or create long-term deficits for the throwing athlete.
Again, we're visiting with Dr. Nick Verma, head team physician with the Chicago White Sox, sports medicine specialist, orthopedic surgeon for Midwest Orthopaedics at Rush. I'm Steve Kashul, along with Dr. Brian Cole. You're listening to Sports Medicine Weekly, coming your way each and every Saturday morning between 8 a.m. and 8:30 Central Time here on The Score. Dr. Verma and Dr. Cole, I want to ask you both, again, parents might be wondering, and we've discussed it, I know, in past shows, but when do I go see an orthopedic surgeon? Let's say my son, he just pitched his first game and there's severe shoulder soreness, and maybe elbow soreness. Should we go see an orthopedic surgeon? When do we go to the emergency room? What do you two suggest as team doctors and as orthopedic surgeons at Midwest Orthopaedics at Rush, advice to the parents on really the fine line between going to see a doctor and nursing at home?
Yeah, I think I can answer that at least from a baseball perspective, and then Brian can give his thoughts and certainly let us know what his thoughts are from other sports. We did a study about 5 or 7 years ago where we asked athletes, and these were primarily high school level players, about whether they experienced pain with throwing. And it was really interesting to see that almost 50% said that they had some pain associated with throwing or following throwing. So some soreness is part of the game. And I think once you've participated in sports long enough, particularly if you're a pitcher, you kind of know when you have that normal soreness after you've gone out and either thrown a bullpen or thrown in a game situation versus when you've got something that's really painful and not normal for you. So for me, that's one of the big hallmarks that I try to talk to our players about is this what you really normally feel when you're throwing, or is this something that just doesn't feel right to you? And they have a pretty good innate sense about when it's normal versus when it's abnormal. So I think that's the first key. And then the second key is, the one thing that I think kids try to get in or end up getting in trouble with is they try to throw through things. And part of that's based on, where we are in team sports today for our youth athletes, where they don't really want to give up on a position in a team, or they're playing on multiple teams and one trainer or coach may not know what's happening with the other team. So they try to gut it out for a week or 2 weeks or sometimes even longer than that. And that's where I really think we see some of the high risk of overuse injuries in our teen athletes. And certainly there's a risk here as we go through this summer where it's going to be an abbreviated season. We only have about 3 months to probably get games in. I think there's going to be a mindset on the youth athlete to say, well, even if I'm hurting a little bit, I just need to get through this season. And so I do think it's behooves the parents to talk to their children about what they're feeling. If they see abnormalities, like they just don't look right on the mound, their velocity's down, they're having trouble with control, they're shaking out the arm between pitches, those are things that you really want to engage your athlete about and say, is something going on, or are you feeling normal?
Yeah, and I think, Nick, those are all great points. I think the other is, number one, our families need to know that if they need to be seen, they can be seen, even at a time when we have some stay-at-home and so forth. The ability to get essential care for injuries, you can still come to Midwest Orthopaedics and actually see a doctor, get an X-ray, get an MRI, and get the care you need. How to differentiate that which should come to the office versus which should not. I think if parents have concern or our athletes have concern, we can also disseminate information simply from a telemedicine visit. So that's something that we've talked a lot about, is how to get someone in now during this more challenging time, but it can still be business as usual. One thing to help our patients differentiate is, look, if there's no event on the day of play, but it starts the next day with soreness, generally speaking, that's sort of a delayed onset muscle soreness type picture from overuse in a setting where, as you alluded to before, where they don't really have the environment at first to do some of the activities they're going to start doing. And as soon as they get outside and throwing hard and other activities that they were previously not accustomed to doing, it's not going to be uncommon that they're going to get delayed onset soreness and maybe some inflammation. So those types of things, if they're patient, stretching, ice, sometimes even anti-inflammatories over the counter can make a huge difference and prevent an unnecessary visit, or certainly provide some assurances to them that, hey, this is something that's going to get better.
Again, we're visiting with Dr. Nick Verma, head team physician for the Chicago White Sox. I'm Steve Kashul with Dr. Brian Cole at Sports Medicine Weekly. And final question for this segment, gentlemen, for both Dr. Verma and Dr. Cole, the restart of elective surgeries. Dr. Verma, you first. What new precautions are in place with the reintroduction of elective surgeries?
It's a great question, Steve, and I think this is very akin to the discussion that Brian just had about our ability to see patients in the office and the fact that we can offer care that's needed as we move through this new and unprecedented time. I think the first thing to keep in mind is that when we say elective surgery, that often implies that somebody's doing it just because they decide that it's necessary for them. It often brings up things like cosmetic surgery, things where it really is elective, whereas most of what we're doing in the orthopedics world is elective in that you could live without it, but it's necessary for patients to return to an active lifestyle, for patients to return to work activities, and for patients to return to recreational activities. So I think elective has to be further defined in terms of, what are essential things to recover function, to reduce pain, to allow for somebody to return to their work or livelihood. Those are the types of things that we're doing in an orthopedic world, which are important to continue and to reinitiate as soon as possible. Today I'm in surgery talking to you guys. We're doing stuff on Saturdays just to try to get through some of the backlog. And the way that we're doing that safely is by, number one, testing. So the Illinois Department of Public Health has mandated that anybody undergoing an elective procedure needs to have a test within 72 hours. Once they have that test, they're asked to quarantine as best as possible until the day of surgery. Number two, we're screening all of our patients for symptoms such as fever, or a verbal screen for things like sore throat or other flu-like symptoms that may indicate a problem or a potential infection. Number three is we're practicing all of the hygiene and cleaning protocols that are in place and recommended by the CDC, IDPH, and other governing bodies. And finally, we're just basically treating everybody with universal precautions. So we're spending a little bit of extra time with cleaning rooms in between. We are using masks that are protective for our staff and for patients, for anybody that's in the facility. We're trying to limit the number of visitors that come in. So if on the day of surgery you come in, your family member would be asked to wait in a separate area. They wouldn't be allowed back into the surgical facility. And then we would do the post-op instructions in a special isolated area where you're not in contact with other patients. So with all of these precautions that are ongoing since we've restarted elective surgery, I should say, I think there's been a high level of patient satisfaction. I think as we look at the patients that we've treated, we have yet to have a documented case where somebody either contracted the virus or was thought to have maybe been exposed to the virus. And so I think we are feeling more and more comfortable that we're able to take care of patients that need our care in a safe way, even despite what's going on in the broader community.
I think the other thing to add, Steve, that Nick alluded to about this concept of elective or non-elective is that, this concept of chronic pain, just general dysfunction, problems with activity of daily living, and so forth, it was really unimaginable that that's what was intended, but we were in a different time and a different place. And I would say that at this point, I've said this before, that we feel more comfortable in the hospital setting, and these are mostly ambulatory care centers. A lot of what we do in sports, for sure, and even joint replacement and spine now at Midwest Orthopaedics is outpatient and has nothing to do with the hospital setting. And I can tell you that there's been absolutely no overlap with what's happening in the hospital system. But secondarily, if you look at the hospital system right now anyway, things are actually very much in control. The number of patients admitted is decreasing. There's no request or demand for any of our supplies, and there's enough what we call protective wear, and also, as Dr. Verma pointed out, the ability to test people. All of this, in my mind, it creates what I would say is an inexorably safe environment to do what we do best, and patients should have little to no concerns about being in that setting.
Gentlemen, great stuff. Again, Dr. Nick Verma, our guest, head team physician for the Chicago White Sox, sports medicine specialist, orthopedic surgeon for Midwest Orthopaedics at Rush. Dr. Verma, thanks so much for joining us this morning on Sports Medicine Weekly.
Thanks for having me, guys. Enjoy your weekend and stay safe.
And Dr. Cole and I will be back with our Ask the Doctor segment. You're listening to Sports Medicine Weekly, only on
670 The Score.
And we're back on this Saturday morning Sports Medicine Weekly. Steve Kashul, Dr. Brian Cole. Time now for our Ask the Doctor segment, giving our listeners the opportunity to have Dr. Cole address their specific sports injury issues. Very easy to submit a question. Just go to our website, sportsmedicineweekly.com. On the homepage, you're going to find a link underneath the photo of Dr. Cole and yours truly. On the right side of that homepage, just click that link and you can submit your question. Got a couple of good ones today for you, Dr. Cole. First one, Dr. Cole, with the stay-at-home orders gradually being lifted in some states, some people are heading back to the gym. Now, whether people return now or in the coming months, what tips do you have for staying healthy and preventing injury when returning to a gym routine?
Well, I think, Steve, the things that are going to come to mind that people will really be concerned about is how do I sort of stay safe, yet get to a gym environment because I'm tired of working out at home or I'm not getting the same kind of workout and I need the gym atmosphere. And I think, what we're likely to see, and it might be region dependent, but we're likely to see is that people will be asked to wear masks. I think there's very good evidence now supporting the use of masks, not just for you to protect me from you, but you to be protected from me, if you will. So it kind of goes both ways. But my guess is the gyms are going to be set up with social distancing in mind in terms of how they spread people out in their workouts. Masks especially become important when you can't do that. Frequent hand washing and wiping down of contact surfaces and so forth, I think are all going to make a big difference. And then obviously how we check in, check out, and do transactions. I personally believe that we can do these things safely, and I'm hopeful that we can return to some sense of normalcy, but always being mindful of the things that actually have always worked when it comes to managing things like the flu and things that are contagious. But the other thing we're going to see, Steve, is that where people have probably been working out differently, and this is where warm up and cool down is going to be even more important. I like to follow the 10% rule. In other words, if you're just starting out a new workout, which for some of us is going to be like working out in a new level of intensity, try not to increase loads by more than say 10 to 15% per week, and you'll kind of get a sense because most of us are going to get a lot of soreness, the so-called delayed muscle onset soreness when we start regimens where we're much more have higher levels of intensity. We've been doing it for a longer period of time. So be mindful of that, and I think what we want to do is avoid thinking that we can go back to the really heavy weight with lower reps out of the gates and not giving yourself time to warm up. And certainly, like any time we're in a regular workout regimen, is to respect your body and consider the importance of recovery. That's also going to be very important. So stretching, mixing it up, avoiding motor memory, and giving yourself some variety can all make a big difference as you enter back into the gyms.
And final question, Dr. Cole. In anticipation of opening NBA training facilities, how much of an advantage has this layoff been for those NBA players who have been injured and are on their way back?
Well, Steve, that's a great question from one of our listeners. I think that obviously it depends upon what's going to happen this season, and right now there's been no formal statement of what is going to happen. But what I would say is that every team had some injuries that the individuals were recovering from, and those players have had more time to get well. And should the opportunity arise this season to play, then I think you may see players back that otherwise would not have come back. That being said, the rehab has been tough, to get people into a good environment. Much like that last question, we haven't had literal access to gyms and so forth. So I think that more time is of the essence. You get a little more time on the backside like this to get back, then you actually can capture the ability to play. But that's weighed against getting the quality rehab that we would often see when you have ample access to strength and conditioning. So it's going to be a little bit of a balance. But we might see, if we were to get back in any fashion, some players that might not have been seen, quite frankly, because the season was attenuated. So, again, remains to be seen where we're going to go with it, but should the option to play come, I think certainly that's a possibility.
Okay, Dr. Cole, we're out of time. Great stuff. I wish you continued success with Midwest Orthopaedics at Rush as you begin to open more and continue with elective surgeries. Also, my best to you and your family. Stay healthy, stay safe, and I look forward to a new show again next Saturday.
Thank you, Steve. Have a great rest of your weekend.
And that's going to do it for this edition of Sports Medicine Weekly. Reminder, net proceeds from our show, Sports Medicine Weekly, go to support orthopedic research at Rush through the liveactivenow.org fund. Many thanks to our producer, Shane Reardon, our coordinating producer, Tracy Torrell. Also want to thank David Cole for managing our website, sportsmedicineweekly.com. He also does our business operations. And then there's Samantha Smith. Our many thanks to Samantha from Midwest Orthopaedics at Rush. For Dr. Brian Cole, I'm Steve Kashul saying so long, and thanks for listening to Sports Medicine Weekly. And we'll be back next week with a brand new edition of Sports Medicine Weekly, only on
670 The Score.